Bismillah ar-Rahman ar-Rahim. Hello, my friends and my colleagues and my fans everywhere. This is Professor Dr. Tarek Ali, Senior Consultant Physician, Internal Medicine Professor of Medicine at Cairo University, as all my friends and my colleagues know. And then I just want to, this is just a reminder video of my presentations today in my Facebook accounts and in my Instagram and also in Twitter, but mainly on Instagram and Facebook about abdominal pain. I had for 5 episodes live broadcasting on the issue of management of acute abdomen, and I already explained the different types of abdominal pain and the different classifications of acute abdomen, and I discussed the surgical, medical and the gynecologic causes of abdominal pain, and I discussed the abdominal causes of abdominal pain and the extra abdominal or the non-abdominal causes of abdominal pain for diseases or pathologies originating in the chest, from the heart or from the lungs, the cardiopulmonary circuit, or from the genital system, the testicles and scrotum in males, and the pelvis and pelvic structures, including the ovaries and the fallopian tubes and the uterus in females, as gynecologic causes of abdominal pain, whether acute, subacute, or chronic and recurrent abdominal pain. So I discussed all of these issues. I discussed in details the medical causes of acute abdomen, including the different inflammatory etiologies, infectious etiologies, including the local infections in the gut, the small intestine, or in the urinary tract, or in the abdominal cavity, in the peritoneum, the abdominal infections, and also the ischemic vascular causes of acute abdomen, and also the neoplastic causes of acute abdomen, that is how abdominal cancer and malignancies present with abdominal pain, in addition to the other symptom combination with the other abdominal manifestations, the neoplastic pathology as a cause of abdominal pain and acute abdomen. I discussed also the hematologic causes of acute abdomen, blood diseases which can present with abdominal pain and acute abdominal pain in particular. I discussed the endocrine and metabolic causes of acute abdomen with all its range, and this is a very important category, especially for me as an endocrinologist and a metabolic disease specialist, as my interest in internal medicine. And then I also talked about neurological causes of acute abdomen as a type of what we call referred pain, and I had one presentation about referred pain as a type of abdominal pain, because we know that the 3 main types of abdominal pain are visceral, parietal and referred. So I discussed the differential diagnosis and the causes of referred pain, that is abdominal pain due to an extra abdominal pathology. I already discussed this, and among them are the neurological diseases which might atypically or rarely present with abdominal pain, especially the autonomic epilepsy and atypical migraine, which can present with abdominal pain in atypical or non-classic cases, and might cause clinical confusion, and the clinician may enter into a diagnostic dilemma and will be face to face with what we call a clinical challenge. So I discussed all of these issues in my live presentations, live videos and broadcasting videos, live broadcasts in my Facebook and Instagram. And then I ended all of these with the discussion of the diagnostic approach to a patient with acute abdomen. What are the different diagnostic tools and diagnostic modalities which we can use them in the differential diagnosis, and to reach to the final or definitive diagnosis of the exact cause of the acute abdomen, so that we can reach to the underlying disease and underlying pathology, and will be able to treat the acute abdomen radically and properly, to identify the cause, to identify the diagnosis, because if there is no diagnosis, there is no proper treatment. So I already discussed all of these, the diagnostic tools which we can use them, starting from the CBC, passing through the different radiological modalities which we can use them in the evaluation of acute abdomen, and then to the endoscopy and the different types of endoscopy, and also the combination of two modalities like endoscopy and ultrasonography together, the endoscopic ultrasonography. And then I discussed after that also the role of laparoscopy and the exploration as a final resort for elucidation of the cause of acute abdomen and treating the disease causing the acute abdomen radically and properly. So this is the my talk and my discussion in the live about the clinical management of abdominal pain, more or less in a concise and detailed pattern. So thank you so much, and just refer to my accounts on the Facebook and the Instagram to listen to my clarification about management of acute abdomen in clinical practice. Thank you so much. My best regards, and I wish for all of you a peaceful, safe day.